When should I see a doctor for the loss of hearing? If you're living with hearing loss, can it be cured? And does hearing loss get worse if left untreated? Hello and welcome. I'm your host, Dr. Musam Tomene, and signing with us today is Atia Asma, and the feeder interpreter is Caitlin Nair. On Vital Signs, we focus on hearing loss and deafness, with World Hearing Day being observed on the 3rd of March each year to raise public awareness on how to prevent deafness and hearing loss and to promote ear and hearing care across the world. Coming up on the program, we'll listen to inserts produced by Zama Buthelezi. She spoke to a mother that discovered later in childhood that her daughter has hearing loss. She also spoke to an audiologist from the Chris Hani Baragwanath Academic Hospital about the importance of screening as well as testing. We speak to the clinical head of Ear, Nose and Throat Department, who is also the director of the Cochlea Implant program at Chris Hani Baragwanath Academic Hospital, about hearing loss as well as deafness. And we can also speak to the Chief Support Officer of the National Institute of the Deaf, as well as a SASL content developer from the NID, on how we can help support deaf people and people who are hard of hearing. Do remember that you can be a part of the show by asking the guests that we have on the show any question that you have on your mind by simply sharing your view with us on what we're discussing today. The number to call is 011-714-5861 or 011-714-5877. Social media is also available, and if you'd like to share your thoughts with us there, head on over on Twitter. We're at SABC Vital Signs, and on Facebook, SABC Vital Signs as well. Vital Signs continues right after this ad break. Welcome back to Vital Signs. Now, it is vital that every newborn has a hearing screening test before they leave the hospital. If your baby doesn't have a screening before they go home, or was born at home or at a birthing center, they need to get their hearing tested within the first 3 weeks of life. Not passing a hearing screen obviously doesn't mean that the baby has hearing loss, but it does mean that the baby should be retested within 3 months. If hearing loss is then found, treatment should begin right away. Unfortunately for Mashudi Makawa, her daughter wasn't checked, and this led to her finding out later in childhood that her daughter is hard of hearing. Take a listen.
Hello. Sit. Sit, sit, sit. There we go.
Arish is a bubbly child. She's naughty and noisy at the same time.
Mashudu became concerned about her daughter not being able to utter a few words when playing with other kids. During her regular immunizations, the nurses were also concerned about her development and ordered her to do some tests.
The nurses, they try to speak with her, they try to make sound to get her attention, and they get none of those. So that's where they decide to write a letter, the transfer letter, to come here at Baragwanath. That's where we came here from Orlando Clinic. We came here and they did first test. The test confirmed that she can't hear. And they did second and third. The results were the same, that she can't hear.
Mashudu had a healthy pregnancy and gave birth without any complications and wasn't aware of her baby's ear condition.
I gave birth normally here at Baragwanath, and they gave me baby and never mentioned whether the child got problem or anything.
Ari had challenges playing and engaging with other kids. She finds it hard to hear sounds. That could be dangerous for kids playing in the streets.
When I am walking with her on the street, Ari never responds to any sound of a hooting or someone's coming with a bicycle. He would just break near her. And when the car coming, she was just being confused. And I was started to be scared, but thought maybe, but I wasn't sure whether it's because she can't hear at all.
Good listening.
To this day, Mashuru doesn't know what could have been the cause for Ari to lose her hearing.
I'm not sure whether she took it from my great-grandmom's side or from my father's side. or she get infection, because they ask, did Are got a meningitis as a baby? Did Are have any kind of sickness? Are never had any kind of sickness.
Unfortunately, Ari isn't able to develop speech, but thankfully for the hearing aid, she will be able to hear some kind of sounds.
She can be able to hear the sound of the car when it comes. They also said an airplane, does the sound, she hear those heavier sound like airplanes, the hooting, the scooter sound. That's the sound that she can hear with those hearing aids. The level 2 of the hearing is still going to reach the maximum level. That's where they said she will be able to hear the speech sound.
After the break, we speak to the clinical head of the ENT department, who's also the director of the Cochlea Implant program at Chris Hani Baragwanath Academic Hospital, Dr. Razvi Ahmed, about hearing loss as well as deafness. Stay with us. Welcome back to Vital Signs. I'm Dr. Musamtomeni. South Africa has a well-established deaf community with more than 4 million people that are deaf or hard of hearing. There are approximately 2 million deaf people in South Africa, which effectively means that as many as 4.5% of people in our country are deaf. Now, hearing loss is a common problem caused by noise, aging, disease, as well as there being some genetic factors that go into it. And the cause of deafness is widespread, but can generally be divided into 2 types, congenital as well as acquired deafness. To help us understand more about hearing loss, we're joined by Dr. Razvi Ahmed, the clinical head of the ENT department and the director of the Cochlea Implant program at Chris Hani Baragwanath Hospital. Good morning, Doc. Thank you so much for joining us today. Let's talk about the importance of hearing before we get into deafness. Why is it so important to hear?
Well, it is important. Thank you for having me on the show, Dr. Mtombeni. It's important because it's an important part of our way of communication. And I think to isolate people from communication if we don't hear is absolutely a problem. So I think it is vital to our normal interaction with other human beings.
So what goes into the development of hearing? I mean, it's going to sound a little bit, high spec, but the basics of hearing, how do we develop hearing and being able to have normal speech, I guess?
So essentially, our hearing is a pathway of sound that travels from outwards in towards the ear, goes through the external ear, gets onto the tympanic membrane, which is the eardrum, and then that vibrates and passes on the signal via the ossicular chain, which are the 3 little bones in the middle ear, and that gets transmitted into the inner ear, which then identifies the sound and transmits it via nerve into the brain, which interprets the sound that we develop. The brain then processes that sound over time, and there's what we call neuroplasticity, which interprets that sound into what we develop as language. And different people have different languages, so they interpret different sounds as language. And over time, that's how we learn to communicate with one another. So we listen and then reproduce that sound to communicate with others.
So from what you've mentioned, it sounds like there are a lot of paths or a lot of ways in which something can go wrong in this development of normal hearing. What are the common ways that you get to see in practice in ENT?
Okay, so from the start, there's 2 types of hearing loss. It's the conductive pathway and the sensorineural pathway. So the conductive, anything that causes an obstruction into the air transmission of sound from the ear towards the inner ear, anything that causes obstruction, even something as simple as wax, impacted wax, foreign bodies in the ear, any infection that causes swelling in the external ear, tympanic membrane problems, infections, rupture of the drum, any middle ear problems such as ossicular discontinuity, which means the ossicles are not intact or they get fixated even in certain cases, that can all cause a problem. And then there's the sensorineural pathway, which is from the cochlea to the nerve to the brain. And any of the problems that can develop there can also cause a hearing loss. Those are much more severe because they need different types of intervention.
So we've mentioned this idea of congenital versus acquired, which basically means you are born with or you get to become deaf due to a number of causes that you've lightly touched on. So what causes people to become congenitally deaf or born with deafness?
Okay, so the most important ones are usually either genetic predisposition to hearing loss, which means that there's a problem in one of the chromosomes, and there are a number of conditions, either syndromic or non-syndromic. So the syndromic ones are where there's associated conditions of the heart, of the kidneys, of the thyroid, and so forth, that actually together with a hearing loss develop in a child and they come out without hearing. The non-syndromic ones are where there's particular chromosomes that affect the hearing only, and in those cases, for whatever reason, those abnormalities in the chromosomes cause a hearing loss which we can't explain. And then there's maternal infections, and the major one used to be rubella, but there are others such as cytomegaloviruses, other infections that can cause in utero problems on the child and cause a hearing loss as well. So those are the two major types of congenital hearing loss that we get.
And then the acquired causes, of course, we've spoken about, wax infection in the conductive systems, foreign bodies and things such as that. Can these be prevented? So I understand how the congenital, the ones that you're born with, is very difficult in some cases for you to prevent that. But for the acquired causes of deafness, can we prevent that from happening?
Absolutely. So the acquired ones, obviously the simple things such as wax and foreign bodies, just normal care and not putting in use of cotton buds and so forth in the ears. For infections, obviously early intervention, early identification, treatment, try and get to your relevant doctor early on to make sure that you don't develop any problems in the ears. And then there are conditions such as meningitis, other infections such as measles, mumps, all of those which can affect the hearing pathway and cause a hearing loss. And then other things such as noise exposure, very loud noises that can cause hearing loss. We get ototoxic drugs, which are used, especially in our situation where we have a resurgence of TB, and with multi-drug resistant TB coming up, we have to use certain drugs that actually cause a hearing loss. So all of those things we need to be careful about and observe and check for.
So we've spoken a lot to this idea of deafness, but synonymously we use the word hearing loss. Is there a difference between hearing loss and people that are deaf?
Okay, so hearing loss can be a spectrum. It can be a mild hearing loss, which doesn't really affect most people, or there can be a disabling hearing loss, which is usually above 30 to 40 decibels hearing loss. And deafness usually implies quite a significant loss where people can hardly hear. But I mean, it's just different spectrums of the same thing. So mild hearing loss may not have much of a disability, but significant hearing loss certainly has a serious disability.
So we've spoken to the idea of diseases as well as there being the congenital and acquired causes of deafness and hearing loss. How do we diagnose someone as having this? I think a lot of the time, and I think a lot of parents will speak to this idea of, this little boy is naughty, he doesn't listen, versus he actually can't hear, so therefore he continues to do his own thing, like we saw in the insert a little bit earlier on. So how do we get to a diagnosis?
So you've mentioned the most important thing at the beginning. It's universal neonatal screening. So when children are born, usually they should have screening, and that can help. But then just to be observant, and parents are quite good at that. Often mums are the best who can identify a child that's not hearing. And those are early indicators. Other than that, people just need to be aware and watch and look for cues and signs that tell you that a child or an adult is not hearing. Adults are much easier. They'll tell you that they can't hear. I mean, if they've been hearing for a while and suddenly their hearing deteriorates, they will indicate that. But children, it's often difficult. And so early cues, calling the child, seeing how they respond, if they're turning their heads towards a noise, and so forth. So I think just to be aware and watching your child as they're playing, as you're talking to them, as they're responding. Are they gurgling, responding, trying to repeat sounds as they get a little older? But the earlier it's recognized, the earlier we can intervene and get better results in terms of trying to mitigate those problems.
So with respect to intervening, an important part obviously falls into what has caused you to be, to be deaf or to be hard of hearing. What are some of the recognizable solutions that you provide for some of the disease spectrums that we've spoken about?
Okay, so for conductive hearing loss, often, we look at the cause. So if it's an obstructed ear canal, if it's a malformed ear, if it's the ossicles that are not developed, we can usually go and try and repair those, or you can get a hearing aid that will also help you. For infections, obviously early treatment and possibly surgery, which might need to be done if there is a chronic disease and not cleared by medical treatment, then we can use surgical means to try and get rid of that infection and repair some of the hearing mechanisms, repairing the ossicles and so forth. Obviously, with hearing loss that we can't operate on, then if there is a sensory neural component that's still intact, we can use hearing aid devices and help the hearing.
With the video clip that we saw earlier on of the young child, one of the big things that are highlighted is this inability to speak. And that's commonly the one thing that the parent would see, that this child isn't speaking like their age mates would. So does hearing loss have an effect on other senses for the child or even an adult?
Well, absolutely. I mean, in terms of communication, so there's a dissociation from people. And it's been shown that children who do not develop speech have a dissociation, and unless they develop some form of communication, and that can be sign language as well, it has to be done early so that they can develop communication skills. So I think that is very important.
Let's talk around the development of these cochlear implants. Who gets a cochlear implant and who doesn't? And what advances have we seen in the treatment of people that may have some deafness or level of hearing loss?
Okay, so cochlear implants are a specific type of treatment for very severe sensorineural hearing loss. And it's done in patients who have a nerve that's intact and functioning, but who cannot be aided by a hearing aid or other device that amplifies the hearing. And so when we determine that a child or an adult can't hear even with the aid of a hearing aid, that's when we would start thinking about inserting a cochlear implant, which directs an impulse directly into the cochlea and sends the signal through an external processor towards that and allows the nerve to be stimulated, which then sends the signal to the brain, which then obviously produces the sound that the person interprets. And that can only be done in those people, as I said, who are very significantly hearing impaired, not in those that can be aided by a hearing aid. And it has to have an intact inner ear, so cochlea, that we can implant into. So scans are done to verify that the anatomy is okay. And obviously, if that's not possible, then there are what we call auditory brain implants, which can be implanted directly towards the brain.
In terms of access to hearing aids and hearing equipment, are there a lot of patients, or South Africa as a whole, do we have a good access to these sort of controls, to these sorts of treatments and aids?
So there are places, I mean, most state hospitals will have audiologists and hearing aid budget, but it is way too little and too few to actually cover all of the people. And since we don't have a universal neonatal screening, I think many people fall through the cracks and many children are left without help. And obviously these children need to be identified very early on because speech development occurs before the age of 3. And if we don't get them early on, then they have a delayed speech and poor speech and non-communication for the rest of their lives often. So it has to be done early, and we don't have enough resources, unfortunately, in this country.
In terms of tips for things to look out for if we're concerned about hearing loss, I think let's break it down into 2 that you could potentially give us for young children. So parents that were missed in neonatal hearing screenings, parents that didn't necessarily get an assessment done on their children, or just finding it difficult to communicate with their children, as well as tips for, older people, adults and things such as that find themselves, being a little bit more difficult in terms of being able to hear.
Okay, so children, I think parents should just see how they respond to noises around them and see if they get startled. There's a startle reflex. If a loud noise causes a baby to startle, often you can recognize that there's some hearing there. Or calling towards the child and see if they turn towards you, making sounds in different directions. And those are simple things. Seeing if they're responding with gurgling and so forth. So I think always be aware and see how the response is to noise and sounds around the child, to little rattles, to speech, to doors closing or startling noise. Those are the, few little tips that you can watch with children and then see, as they get, but by the time they get to 2-3 years of age and they don't have any speech, it's already a problem. So by the time they're about a year, they should be starting to gurgle and starting to say at least a few words early on. In adults, it's much easier because adults who've been hearing will start noticing that they have difficulty. Initially, it might be in crowded situations or when they keep having to ask somebody to repeat themselves, or they hear a sound and they can't interpret what the actual speech was. So those are just some things that you can start looking at and saying you need to go and have it checked out. And I think as soon as you notice something and you're aware, it's better to have it checked out. And if it's not a problem, obviously it's confirmed. But if there is, then early intervention can start.
It's better to have it checked out. Before you go off, Dr. Ahmed, we've got a caller, Julia from the Northern Cape, if I'm not mistaken. Julia, good day.
Hello.
Hi, yes, Julia. What's your question for Dr. Ahmed?
The question is, I have lost my hearing since I was young. My other ear doesn't work at all.
Mm-hmm.
Yeah, so I wanted to ask the doctor what may be the problem.
All right, just Dr. Ahmed, I think you've sort of heard the scenario. Before we take her off, any quick questions that you'd like to throw her way?
Sorry, I couldn't get exactly. Is there one ear that's not hearing and one that is? Is that what you say?
Yes, one ear that's hearing, one ear that isn't since childhood.
Okay, so often, it might be a problem that hers was congenital and only recognized later. And if she's coping, generally most people who have one hearing ear do manage, but it's always better to have binaural hearing, which means with both ears. So I think she needs to go and have it checked out. If there's some hearing, residual hearing in the ear that she feels does not hear well, she may actually be aidable, so she can get a hearing aid. There are also other devices that can transmit sound from the good ear to the poor hearing ear, and those are cross hearing aids, or there's bone conductive hearing aids. So there's a variable number of interventions that can take place. But obviously, the first thing is to actually verify and establish the type of hearing and what the problem is. And there may be a medical problem that she needs to have looked at.
Thank you so much, Dr. Ahmed, for joining us today, and I hope Julia takes that advice. Big news for you, Julia, is to go out and go get assessed, go get tested, and make sure that you actually understand what has caused you to lose your hearing so that you get the actual aids that will assist you. And that was Dr. Razvi Ahmed, and that is a person who is a clinical head at Chris Hani Baragwanath for the ENT department. We continue our discussion around hearing loss as well as deafness after this ad break. Welcome back. Why is it so important to get hearing test? Well, the purpose of an adult hearing screening program is to identify patients who are unable to hear normally and they are willing to seek treatment. Now, adult hearing screening may be directed to detect a range of different degrees of hearing loss depending on the target that is being checked for. Take a listen to this insert at the importance of why you need to do that screening.
Chris Hani Baragwanath Hospital offers a wide variety of treatments for hearing, right? So to start it all off, we just keep it simple. We screen you, we see what the problem is, and then moving on from there, we decide what you need. So it could be something as simple as regular checkups. Some even go as far as needing devices. So we're talking about hearing aids here. There are different types for the different types of hearing losses that people may have. And then if all else fails or you need something way stronger, you're often given an option of a cochlear implant, which you might have seen that people wear on the side of their heads. The older you are, like your body is not the same. So your eyes will not be the same as you were when you were 20. So a 60-year-old may experience a problem with their hearing the older they become. So usually those people, we call it presbycusis. So it's just hearing loss due to aging. That's basically it. We've actually come up with a program for kids. It's called the EDI program. So it's just early identification of hearing and intervention. So we make sure that every child who is born, they have to go through the screening procedure. So it's just nothing too hectic. It's a matter of just making sure your hearing organ is actually working fine. In terms of how much you pay, it actually depends on your hospital classification, your nationality, and many other factors. So the amount you contribute to a certain amount that you have to pay for a device will depend on what your hospital classification is. So people who are pensioners, our elderly, our retired people, they usually get our services for free. Then you get those that are more of our low-income patients, so they'll only contribute like maybe roughly 10% to each device that they get or each type of treatment that they get. And as it goes on, so how much you have or how much you earn determines how much you will contribute to the device that you need. Any problems that we had in the year 2020, year 2021 have been addressed because we have employed more staff, we've tried to move faster, we've tried to make our services more lean. We even have a short planning and eval session that happens every 6 months, so just so we go through stuff like what do we need to do, what can we do better, just so that we keep our services moving and efficient all the time.
After the break, we speak to the Chief Support Officer of the National Institute of the Deaf, Andries van Niekerk, and the SASL content developer from NID, Dirkie Ibbison, about how to help and support deaf people and people who are hard of hearing. Stay with us. The National Institute for the Deaf launches various projects on a regular basis to sensitize the hearing community and make them aware of the deaf community's challenges and how they can be addressed more effectively. Now, the vision is to promote deaf-friendly and deaf-accessible communities where deaf people can take their rightful place and develop and live out their full potential. Here to discuss how we can help and support deaf people and people who are hard of hearing, we are joined by Andries van Niekerk, who is the Chief Support Officer of the National Institute for the Deaf, as well as Dirkie Ibbison of the an SASL content developer. Thank you so much for joining us today and joining us this morning. I think let's have a conversation with you, Dirkie. I think I really want to get into your mind and really your life. Take us through the journey of how you became deaf or how you are deaf.
So yeah, I was born deaf. And there are 3 siblings in my family, and my eldest brother is deaf as well. Then I'm the second oldest, also deaf. And then for the third one, he's hearing, and we think it's because he got grommets on a timely, so I don't know why. There was no illness in my mother, so unsure.
So take us through a day in your life. What does a day in your life look like? I think a lot of people, are so used to, their lives being, this world of hearing, but it's obviously different for you. So what does a day in your life look like?
I think I have a pretty normal life. I go to work. I have an office where I work. Fortunately, this is a very friendly space for me because there's a lot of deaf people who work with me. So behind me, you can see my deaf colleague, and across from me is a deaf colleague. So for me, it's a quite comfortable place. If I were to work in some place where I was the only deaf person, it would be very difficult. But fortunately, I grew up in a time where speech was very important at schools for the deaf. So I'm speaking pretty well. But for now, in my current situation, I feel like I have a pretty normal life.
How difficult is it for you to be in spaces? I think you've mentioned the idea that, you know, you're in a work environment where other deaf people are. But how difficult is everyday life around people that don't necessarily understand that you're deaf or know how to communicate effectively with someone that is deaf?
Yes, I have friends who work, as I say, outside of this sphere. And it's very, very difficult, not only in the workspace, but socially. So if you try to be social in the workspace, you don't really know what's going on. So if someone's laughing, should I laugh along with him? Should I not? What's funny here? So you don't really feel like you fit in. So for the most part, you just isolate yourself and not take part. Also, if you have work and there's conflict, how do you resolve that? If you can't communicate in the language that everyone understands, it's very, very challenging. So depression, I feel, is a very common thing that we see among deaf people in those communities. So it's important to have some kind of accessible communication, so some kind of awareness that why do deaf people do this or that, or, you know, figure out some strategy for communication, even if it's basic sign language or how to speak clearly. So that's what my advice would be to those companies. There are courses available, some are even online, and some basic signs is important. And there are accredited courses as well, so that will help.
I mean, there are a large number of people that are deaf or find it hard of hearing, and I think the statistics sort of back that up as well. But with what you've just said, I think it's pretty clear. And looking at my life, and I think a lot of people's lives around us, there aren't a lot of deaf-friendly services. I mean, you walk into a workplace and no one really says, you know, this is a basic sign language course that you must do. These are the basics, so that if you do come across, or if someone, you know, that is deaf is in the workspace, this is how we continue with it. So is access to these spaces limited, or is more supposed to be done to just increase the visibility?
Yes, I definitely have felt that. And I have many experiences with banks. And it's your finances. You don't want to have any misunderstandings there. And I've had experiences where I go to the bank and they have a disability desk. And that's primarily for people who have a wheelchair. And that applies now to me as well. And then I ask, please slow. Take off your mask. I can't understand you at all with your mask. So speak slowly, or I type what I want to communicate on my phone. So the attitude of the staff person on the other side is critical. But I've had some really difficult challenges. Also, when you go to the shops, Checkers or ShopRite or any of those, I was very surprised to see when someone signed to me, "Thank you." And that really makes you feel part of the community. So every small perk helps.
So you've mentioned something, and I think it's an important one, especially coming or still being in a pandemic, the idea of mask wearing and your inability due to that of lip reading in that sense. How difficult has the period of 2020 to 2022 been with respect to communicating and just really getting basic messages out or communicating with people in the community?
Yeah, I really enjoy eating out. So I love going to restaurants. And then I would go through the menu and point at the one that I want. So that's how I usually do. But then the waiter wants to know, do you want hard eggs or soft eggs? So with a mask, all I see is a mask going and I see eyebrows raised. No, I want this. And then they take down the mask. Oh, okay, yes. So the waiter is taking a risk by exposing yourself or himself because they can't sign. So that's nice. But it helps to always go to the same restaurant because I have some favorite waiters and then they come and they ask me, they sign to me. Do you want coffee? Do you want cold milk, hot milk? Then they don't need to lower the mask. But without the signs, no access with the mask.
Quite a difficult time. So before we wrap up with you, Dirkie, as a South African sign language content creator, what goes into that and what message would you most likely, or rather most want to get out there?
I am supremely excited. We have a sign language dictionary, that's a video dictionary that's releasing this month. And we have various signs from schools for the deaf and deaf communities across the country, about 20, that we collect and put onto our video dictionary. And then we try and identify the sign that's most used to create some kind of standard together with the Pan-South African Language Board. So I'd like to encourage everyone to just use the resource that's available. We have about 1,600 signs at the moment, but on our database, we have about 5,000. And this is wonderful quality. It's HD video. You can, for example, and it's not only for hearing people, it's for deaf people as well, because if you know the sign, you can go and look for the word. So if you know a sign like this one I'm showing you now, you can look on our dictionary and do a reverse search. Okay, so this is the handshake, this is the location, and then it shows you all of the signs that have those parameters. So it's a RAM, which is a nice and complicated function that you have in a dictionary. And this has been many years in working.
Sure.
So we're super excited about this, about our new dictionary, and I really love to share this with the whole world. Really proud of what we've done here. So it's been really hard work. And this is my responsibility developing this, and I'm really, really excited about this.
It sounds very exciting, Dirkie. I must say, I'm one of those people that have always had that idea that, you know, I want to and would like to potentially learn how to sign, learn the basic signs. But, you know, you always get distracted with other things because, where am I going to go find this sort of resource? And coming to light or having this launch within the month or later on this month is very exciting. Good luck to you guys, and let's really get the message out there and get everyone that can't sign to learn the basic signs so that everyone is included in society. That was Dirkie. Thank you so much for joining us, and we're going to continue our discussion, and that is, of course, with Mr. Andries van Niekerk, who's still on the call with us, and he is from the National Institute of the Deaf, for the Deaf rather, and really looking at what the organization does and how we can better our communication and better our sort of interpretation and bringing in communities to have discussions around being deaf and what the loss of hearing actually means. So, Andries, let's continue our discussion. Before we go any further, what does your organization do?
The National Institute for the Deaf provides predominantly two types of services. On the one hand, we provide a care service. We have 2 centers for multiply disabled deaf people. So these are deaf people who have additional disabilities, some up to 5 additional disabilities.
Sure.
And there aren't any other centers in the country where they can be accommodated. So here we have what we call a mini village, where we have all of our residents and they can all communicate with each other. It's very accessible. And then we have an elderly care center, an old age home, and also for deaf people. And as the previous doctor mentioned, people who become older tend to lose their hearing, and old age homes are filled with people who struggle to hear and struggle to communicate. And our center is catering for those people, and we have a very accessible environment there. So those are the 2 care centers. We have a third area, which is where I and Dirkie is involved, and this is where we develop and create and do research in South African Sign Language. So we have, as Dirkie mentioned, we have the very first bilingual dictionary, and we also have an accredited online course. We have storybooks that's intended for children who are deaf with hearing parents, and several other projects that we have, and also with regard to interpreters, which we have a shortage of in South Africa. And so in a nutshell, yeah, that's it.
So what are some of the challenges that the people that look to you to offer support generally complain about or say they're currently dealing with, and what solutions do you come up with to try remedy that?
Most of the complaints that we receive are from deaf people in the workplace. In fact, just this weekend, we had a complaint from a deaf person who felt that she was being unjustly targeted in the workplace. So she felt staff members were talking about her behind her back. They were intentionally making loud noises. She wears a cochlear implant, and loud noises are very, very distracting for some deaf people, because as a hearing person, you learn to ignore certain sounds, but for her, it's very, very distracting. So we had a complaint, and those are the kind of complaints we frequently get. Conflict in the workplace, as Dirkie also mentioned. With that, what we do is we do a sensitization and awareness session. This isn't always successful because it depends on the attitude of the people. But we talk to them about deafness, what's it like to be deaf, what can you hear, what can't you hear, how do you improve your communication? So all of these kind of strategies that we teach. The second problem that we frequently get is there's no access to any kind of government service. We frequently get calls from the police service. So they would say, there's a deaf person here at the police station, we don't know what to do. At the hospital, it has happened so many times that deaf people end up there and they are accompanied by a family member. And the family member says, well, this is what's wrong with this person. And the deaf person has no idea what's going on and just smiles and nods. To be fair, here in the Western Cape, the government, the Department of Health, they have allocated resources to sign language interpreters. So if you go to a government hospital in the Western Cape, you just WhatsApp a number, and then they will organize a sign language interpreter for you, which is fantastic. But then you have the case where you don't always have a reliable interpreter. We all know what happened at a previous president's memorial service, when we had a sign language interpreter who wasn't a sign language interpreter. And there's a whole gap where interpreter certification and interpreter regulation in South Africa, there's not really any popular and accessible service that deals with that. So we are also asked about, is this interpreter good? Should we use that interpreter, or who should we use? So I think it boils down to those two things.
In terms of access to screening, or increasing the screening that we do get, because a lot of people, I think, find themselves having hearing loss to a point where they think it's normal to not be able to hear, I don't know, someone that's 20 meters away or whatever it might be at that point in time. Is screening something that should be encouraged, and is there policy that's currently either in place or coming, or something that you're advocating for to get screening done, not only in workplaces but in schools and places such as that, so that the surveillance is increased to see if anyone is hard of hearing or deaf?
That is an excellent question. I have very good friends of mine, and they're both deaf, a married couple, and they have 3 children. And you would imagine that being deaf themselves, they would be ideal to notice if their own children would have a hearing loss or not. One would imagine that to be the case. But in their case, their eldest son is now 5 years old, and they've only now discovered that he has a hearing loss. And the reason for that is that his hearing loss isn't severe or profound, but they rely on eye contact for communication. So they could never be exposed to that circumstance where they called the child and they figured out that the child couldn't hear them. That never happened because they always relied on eye contact. So it happens even in deaf families, which I was very surprised to hear. Currently, we know there's no policy that enforces early intervention and screening at government hospitals. It doesn't happen. The largest challenge with that is that the screening happens for some and not for others, but they have to come back. So you can have in the first 3 weeks or the first 2 weeks, but you have to come back at 3 months. And that rarely happens. And we all know that language deprivation, well, I should hope you all know that language deprivation is a terrible thing. Imagine where you would be if you didn't have language. Just imagine that. So the critical part for any child who has difficulty accessing any kind of spoken language, I think you have to give them access to some kind of language. And that would happen to be a sign language, but if you could boost their hearing enough, that would be a spoken language. But it has to be an accessible language.
Thank you, Andries, for joining us and really discussing why it's so important to advocate for people that are hard of hearing and people that are deaf, especially as we commemorate World Hearing Day tomorrow. Thank you so much for being here and being able to share that information and advocacy with us. An important thing to remember, of course, when we speak about deafness is this idea that once your hearing has decreased, I mean, we've received calls throughout the show about people complaining about, you know, their hearing is decreased or they can't hear, is to go out and get tested. It's so important to step out of this world that you're in where your hearing is depreciating on a daily and really go out there and get help. And as Mr. Andries has sort of highlighted, is this idea of following up. Continue to follow up until you get the treatment of what is actually causing you ailment and any problem. Sitting at home and wasting your hearing away is not going to assist you at all. Get the help, especially if it's something that can be treated. Thank you so much for joining us today. Remember to stay safe, continue to wear a mask and look after yourselves. From us here at the Vital Signs team, we'll see you soon.